WNYT, Albany, in HD. News Channel 13, live at 5, begins right now.
Coming up, battling gum disease, the high-tech procedure now replacing traditional surgery right here in the capital region. In your health, half of all Americans have periodontal disease, and many of them will need surgical treatment to get rid of the bacteria in their gums. Traditional surgery is slowly being replaced with a laser procedure called LANAP, and it's arrived here in the capital region.
How little inflammation there is in the tissue now.
Albany periodontist Dr. Ference is checking the progress of patient Dave Stack. Back in August, Stack underwent periodontal surgery, but it was a far cry from the procedure he had some 15 years earlier. This time, Dr. Ference used a laser instead of a scalpel to remove diseased gum tissue, making Stack a very satisfied patient.
Yeah. A lot less painful, a lot less swelling. Recovery time is a lot quicker.
Less pain, faster healing, and less tissue loss are the hallmarks of treating periodontal disease with LANAP, laser-assisted new attachment procedure. This is why, instead of cutting into diseased tissue with a scalpel, a tiny laser fiber is inserted between the tooth and the gum. The frequency of this laser, a red laser, targets only damaged tissue, because that tissue has different light absorption than healthy tissue. And when the laser hits the damaged tissue, it cuts away and kills the bacteria, leaving healthy tissue unharmed.
Then we go in with ultrasonic instruments and hand instruments to remove the calculus and contaminants that are on the root surface.
Then the same laser with a different setting is used to trigger some bleeding and then create a special scab, which together promotes tissue regrowth, not seen with traditional surgery.
So we're creating a super Band-Aid around the tooth as it's healing.
And as it heals, there's less gum shrinkage as compared to traditional treatment, so patients don't experience as much sensitivity to hot and cold afterwards. The cost of this treatment is comparable with traditional periodontal surgery. The FDA approved LANAP in 2004, but the cost of the unit, about $50,000, held down widespread use until recently, as more studies showing its effectiveness have been published. And yes, this is covered by insurance, Dr. Ference tells me. Now, because of the reduced pain and recovery time, LANAP may attract people to treatment who stayed away before. For more info on LANAP, just go to our website, WNYT.com. I've set up a link.